Thank you. Mr. Chair, I yield myself as much time as I may consume.
The gentlewoman is recognized.
It is fitting that H.R. 987, a bill that would protect the progress of the Affordable Care Act, should include language that would reinforce the federal Navigator program, which provides outreach, education, and enrollment assistance to consumers looking to buy health insurance. This administration has slashed funding for federal marketplace navigators in recent years, with some states facing cuts near 96%, undermining the exchanges and hindering the ability of consumers to choose the insurance plans that work best for them. My background in education makes it hard for me to understand why we would ever want to eliminate tools to help educate the public about how to access health care. It is even harder for me to understand why we would want to limit this critical funding just to states that operate within the federal marketplace. Residents in states like California, New York, Minnesota, and Connecticut deserve to have the same opportunity as people throughout the rest of the country to learn about their health care options, to learn how to sign up for coverage, and to learn how this coverage will work. And so my amendment would open Navigator funds to state-run marketplaces so that my home state of Connecticut and the 11 other states that operate a state-based exchange could benefit from this funding. The Affordable Care Act helped more than 20 million Americans sign up for health insurance. People of color experienced some of the largest gains in coverage under the Affordable Care Act, finally reducing long-standing racial disparities. But in recent years, my own state's Access Health CT exchange experienced a marked decrease in enrollment with communities of color, a worrisome sign that the progress that has been made in health care coverage with the passage of the Affordable Care Act may be slipping through our fingers. Cutting funding to the Navigator and outreach programs represents underhanded attacks on the people that need health care the most. It is part of this administration's subtle strategy to roll back the protections of the Affordable Care Act by reducing health care access as a last-ditch effort. The simple fact is that brokers do not always serve these communities. There is an urgent need to reinforce and expand outreach programs to make sure that we are reaching people in all zip codes of all demographics. State-based exchanges are already doing their part to be flexible, to invest in outreach, and to partner with all communities. Access Health CT even expanded their open enrollment period this year after the Texas v. United States decision was unveiled in December. The exchange knew that it had to combat misinformation, that the Affordable Care Act was still intact despite the Texas decision, and that people could still sign up for coverage. State-based exchanges need all the help they can get to support these efforts. Mr. Chair, I reserve the balance of my time.
The gentlewoman yields. Reserves. Pardon. For what purpose does the gentleman from Oregon seek recognition?
Good afternoon, Mr. Chairman. I stand in opposition to the amendment and request time in opposition.
The gentleman is recognized for 5 minutes.
Mr. Chairman, I'll reserve my time.
Gentleman reserves.
How much time do I have left?
Connecticut is recognized.
How much time do I have?
Gentleman has 2 minutes remaining.
Thank you. Mr. Chair, I want to point out that an estimated 90 million Americans still have low health literacy. These people are disproportionately lower income Americans, elderly Americans, and Americans with low English proficiency. There's a clear need and urgency for the federal government to help these people in states that operate state-based exchanges, and there is precedent for my amendment. My state exchange has received roughly $3 million for the in-person assister program from the federal government. The bottom line is that the rules of the road have changed since changing the requirement to provide health care coverage to all Americans. There has never been a greater need to shore up programs that make certain working Americans, especially underserved populations, are protected and insured, that people in all communities know what their options are and know when and how to access these benefits. I strongly support H.R. 987. I think that my amendment will make it even better. I urge my colleagues to support this amendment. And now I yield the balance of my time to the gentleman from New Jersey, the leader of this important bill, Mr. Pallone.